And I also knew that I had to come back to Ghana earlier than most of the people I know, because in America, most of the Ghanaians retire and then they come back and enjoy their retirement. But I wanted to come back when I had more energy and to give back. But so when I came back and I was doing my humanitarian work, I realized that in Ghana, politics is everything. You know, politics can even decide who has basic amenities. Politics decides who gets the job. Politics decides everything. So I realized that perhaps I should get myself into politics so that I'll be in a position to do more than what I was doing.
So the Healing Hands were not healing everyone, the organization that you were involved with?
The Healing Hands was doing a lot of work, but it was more siloed. In the position of policy making, in the position of legislation, I think that I could do more and cover more people. You know, as a surgeon, I'm in my consultation room. Somebody comes, I do surgery. Most of it, which I was doing in Ghana, was free. And the Healing Hands, I would bring my physician friends from the US and from other countries to do free surgeries. Sometimes we come and we do about 500-600 operations for free, and we see about 3,000 people with all ailments, and we bring everything. We bring our own medicines, our own consumables, and we do just about everything. So everything is literally free. But I realized that in a legislative position, I could even do more than what I was doing. So, of course, I did my consultative work, and then I decided to run. It was not easy because, remember, I was the candidate for 2020, and I believe that I won in 2020, but everybody knows what happened. Then I knew that I shouldn't give up also because, one is from the family that I came from, two, from my own immediate family, then three, it's as a woman. You know, a lot of girls look up to us and a lot of women look up to us. So we need to be more resilient. So I couldn't have said, oh my God, look at what happened in 2020, so I give up and poor me and I'm sad and all that. I couldn't do that. So I had to literally lace my boots and continue. So after the 2020 election, I didn't give up. I didn't sit back. I decided to even do more, because I realized that as a woman, perhaps I had to do 10 times more to get the same level of recognition or to get the same level of satisfaction, not per me, but per other people. So I really put laced my boots, and literally in my constituency, there is no town, no village, no river, no ravine, no valley that I haven't been. So I can literally close my eyes and tell you everything about my constituency, because I really had to get to know the people, get to know the needs. I had to, in my mind, divide the constituency. I have three basic areas. We have the fishing area, because we are right along the side of the beach, so the Bosom Trisam Harbour and all of those are within my constituency. Then we have the peri-urban side of my constituency. Then I have a huge farming community where we have rubber plantations, we have cocoa plantations, we have coconut, we have citrus. So it's not even the same. You can't look at the constituency as one big thing. Then, of course, I'm a woman advocate. So I also have to, whatever I do, really consider women in everything I do. So I also prefer to have women in what we typically call all men's role. So when something comes up and I get lists and I say, oh, give me a list of people for this, and they bring all men, or because they think that traditionally that role is for all men, I say, okay, let's divide it. Let me find 5 women and bring them in, and then so it'll be 50-50.
Because in all the 3 areas that you've mentioned, they are very male heavy. Men usually are the ones in the canoes on the high seas. When they do beach, when they come ashore, then the women take over massively on the processing, storage and sale. In farming, the men usually own the lands, and they are usually the ones who are deep in the bushes. You mentioned cocoa and rubber. I know there are some galamsey issues there. Again, male heavy. And when you come to the peri-urban side, perhaps that's where in the informal sector, women are more of the business owners. Women. So I'm trying to link the dynamics of all these things to chart a path towards how do you prioritize what needs your attention when you have a constituency with this much diversity.
Thank you. So in terms of women representation, no matter what I do, I have to, it almost has to be a deliberate effort. So, for instance, if a Greek minister says we're coming to do like poultry farming, for instance, I would expect that if I even ask the farmers to bring me names, every name they'll bring will be men. So I have to deliberately make an effort and say, no, where are the women? Who are the women who are poultry farmers? Perhaps they don't have the capacity as the men do, but let me bring one or two women who perhaps don't have the capacity, but we can train them to meet that capacity. I believe that as a woman in any field, you really have to make a conscious effort. It's not going to come naturally. And of course, you're going to get backlash or pushback, let me put it that way. But you literally have to make all the necessary requirements and maybe even to push the women. Otherwise, women will not be represented.
Be intentional.
Almost super deliberate. So I have to scrutinize every issue. I have to scrutinize every list. I have to even make effort to reach out to women, because sometimes even they themselves will not bring their names. So I have to make a deliberate phone call and say, I need a woman to do this. For instance, they just went to Hajj. All of my previous Hajj people who have gone are men. But this year I decided that no matter what, I will sponsor 2 women to go to Hajj. It's a little bit unheard of, because it probably should be 1 and 1. But if I don't do that, then the women might not even have the opportunity to go, or they might not even bring up their name. So I made a conscious effort to call the women and say, listen, this year I will sponsor you to go to the Hajj. So those are some of the things that I think women leadership, we have to really make conscious efforts. Oftentimes they say women are their own worst, and they have some cliche things to make women feel like every woman in every field is competing with each other. I don't subscribe to that. I think that those of us who have had the opportunity should really do everything we can and make deliberate efforts to even go and poach them and bring them into the arena. Otherwise, we will have less presentation. As you look at Parliament now, we're only 14% of women. So if you have, let's say, 50 committees, and you only have 20 or 40 something women out of 275, like how many of the committees can you find the women? So oftentimes you see committees with not even a woman representation.
Trust Doc to make an Ebola conversation a gender advocacy conversation, but I feel that the people that you represent would want to hear some of these things, and for your plans for the concerns of your constituents. Road conditions, many believe that residents, not the residents can see, they live it daily, some of the immotorable inner roads within the constituency. Power and utility concerns have been made. The market relocation is a huge situation that is being dealt with. Water and sanitation and just improving the livelihoods of the people have always been topical for the good people. Under this administration, under your watch as MP, what is your plan for the constituency?
Thank you, and everything you said is absolutely right. We are underdeveloped, I think, and severely under-resourced. So my job is to provide to the good people of Iskadukat and some of these things you mentioned. Since I've been maybe a year and a half now, let's say 1 year and 6 months, my goal is to provide the much needed infrastructure. But as I'm doing infrastructure, I'm also looking at the soft things, like the scholarships. I've given over 250 youth free scholarships to go to university, basically the continuing students, not just for university, but also for secondary schools. Every child that is going to secondary school, last year, I gave them like trunks and chop boxes. I currently have a school bus. It's been maybe about more than 6 months now, that picks up free every child that really needs to go to school. So we have had 2 routes, or what we call 2 routes, where they make stops and ends up in the secondary schools. So my constituency is huge. I've divided it into 2. One bus, bus A comes from the south and bus B comes from the north. And then it keeps picking up the whole day, and it is completely free to any mother or child who wants to go to school. It has never happened before. This
They
is
are
the
picked
first
up
time.
at the roadside
They are
and dropped
picked
at
up at the
school.
roadside and dropped at school for free.
How do they know which schools they're going to?
The route will stop because we know our secondary schools in the community and in the constituency. We also know our primary schools. So we have picked the stops. If, for instance, since we started, we have kind of modified the stops a little bit, because sometimes in the beginning they go there and there are not a lot of people there. So now we have made arrangements and announcements and public education, and everybody knows where to meet the bus to go. So currently, as we speak, Iskaduketan has free buses for all of their
Is that
students.
from the MPs? Is that financed from the MPs Common Fund?
No, it's not from MPs Common Fund. It's something that I always wanted to do. So this is like my own private thing that I do. It's not from the Common Fund.
Why weren't you doing it when you were not MP?
Because
some might say you're using it to score political points.
No, it's really something that I'm using as a social intervention to support the mothers, especially, who need to now give money to their children to go to school. The children, you see them standing at the roadside waiting for buses. Some of them are even late. And tardiness in my constituency is directly proportional to how far they have to travel to go to school. So to remove all that and give them the opportunities that perhaps I had is to really make it easier for them to get to school. So all you have to do is stand at the roadside. The bus picks you up, takes you to school. At the end of the day, the bus comes back, you sit in the bus, you go to school. The children are so excited. Even the parents, and a lot of them have written me to say that they have never seen anything like this before. But not only that, for the free buses, I'm also doing, with my common fund, I want to concentrate on infrastructure development. So currently I have built maybe 5 CHIPS compounds in less than a year and a half. And when I say CHIPS compound, I don't mean the small, the one-room CHIPS. I mean clinic worth CHIPS compounds to completion in less than a year and a half. We've done one in Ishim. We've done one in Kansarodo. I'm currently doing one in Intankofer. We're also doing one in Kojokrom, Sabuzongo, that were completely finished. Like, it's not a project that we are now thinking that we're going to give for contract. Finished, roofed, and now the next step is for me to make sure that they are all fully equipped. So on my birthday was May 10th. The money that I was going to use for my birthday party, I used it to buy equipment for all of my CHIPS compounds at the primary care level. So all the CHIPS compounds, all the health centers, as well, all the way even up to Efian Kwanta, which is now our regional hospital. I was able to partner with another group called AYA, GIZ, and they brought the equipment. I also added hospital beds, and we distributed to every CHIPS compound, every health center, and every polyclinic within the Iskaduketan constituency. So as I'm doing that, like you said, sanitation, surprisingly for me, is I can't understand it, why we still have like public toilets that are really not fit for purpose. And when you look at my constituency, it's scattered all over, and it's sort of one of the reasons, one of the things that really baffles me, I mean, in 2026, right, 21st century, why are we even looking at these kinds of public toilets? So I really want to make it one of my agenda to ensure that even the ones that are broken down, we will rehabilitate it, and then look further to see if now the biodigester issues, now they're smaller, you don't need to dig a big septic tank, those kinds of things. So I'm really talking to companies that will look at biodigestion issues so that maybe a compound house can get one. We are still in the feasibility stage. I know the Assembly had done it in the past, but I'm trying to retrieve all that and put proper data and information together, and especially the old towns. And now when you go back to the old towns, we also have sanitation problems where even the receptacle, the trash receptacle or the boiler receptacle, when it comes, it's overflowing, it bangs the floor, the sanitation issues. So for me, my constituency, we have about maybe 145 total population. My voter population is about 90 something. I believe if we open it, we'll go up to about 100,000 people for voter population alone. So it's a huge constituency. Even in the Western Region Metro, we have 5 constituencies. We have Takrady, Sekendi, Iskaduketan, Efia, and Kwesi Mintim. Iskaduketan is the largest. You can take all of them and fit them into Iskaduketan, and the most diverse. And not only that, I'm also the only woman in the 5 metro constituencies. And I believe that I'm the only one who's actually the MP for my own hometown. So my expectations, or even for myself, is much, much higher than anyone else can put any expectations
because it's personal for you.
Because it's very personal. And
they know where to find you. Your mother, your auntie,
exactly,
your uncle,
everybody
your cousin
knows
who's
me. Everybody knows. They will tell you how I was born and what I did when I was a child. And so in Fanti, we have something, a proverb that says, "Wazaye na waranaye." So that means that for the constituency to really look the way that I envisioned it, it has to come from me, or the systems that I put in place. So if I put proper systems in place, hopefully my predecessor or the one becoming after me will also know that, this is where the trajectory or where we want to go as a constituency. So let me go and contribute. Okay. So I've done a lot of infrastructure development. We're building public toilets. We're building clinics. We are doing schools. Yesterday, I got a huge request that one of my schools, the ceiling is off. 2 schools, 2 different locations. So this week or today, I'm trying to get contractors to go and see how best. And sometimes I don't have to wait for common fund, or I don't have to wait for government to give me money. Again, like I said, if this place is going to do well, I think that I am the largest stakeholder. So the more I put in, the more likely the vision that I have for the constituency will be realized. Okay. In terms of the market, we are still going to build it in
Eshem people are waiting for an answer to their request.
Which request? The road or the
market?
No, it's Kojokrom.
Kojokrom.
Yes, it's Kojokrom. So Kojokrom market, we are going to build it. We have already given it to contract already. It is going to come from the GET fund, and it's part of the district assembly GET fund that comes to the district assembly. We are in feasibility studies. What happened is, when you want to do a 24-hour economy market, to really realize what a 24-hour economy means, that means that some of us will go to that market and we won't sleep 24 hours. So what I envisioned was that if they're looking for land, maybe let's say 10, 15 acres. But I think that if you take it outside, on the outskirts, the idea of the 24-hour economy will not be realized, because people will go there and by 2, 3 o'clock it's closed. I want to bring it into town.
Into the middle of town.
Into the middle of town, where some of us don't sleep, where I go to the market at 2 a.m. and I'm walking. I mean, this is what I do now. At 2 a.m., sometimes we are walking through the market at 2 a.m. So I want to bring the 24-hour economy market into Kojokrom market, where we can realize that whole 24-hour economic concept. So we don't already sleep. So now if I bring the market, now we won't sleep. We will stay up all night. And luckily for us, the market is one of the few markets in the Western Region Metro, the only market in the Western Region Metro that is attached to a train station. Okay.
So this could, turn into a constituency conversation entirely. But let's now bring focus to health. And you're serving as Deputy Minister. Yesterday in Parliament, the minority was not very happy about what they call the failure of the health minister to come and answer some questions. Would you have any comments about that before we get into the
the only thing I have is that sometimes they invite, not sometimes, we are mandated as a legislative body to invite ministers to ask questions. But the fact that you have invited the minister, perhaps the minister is doing something else for the country as well. We are having Ebola issues going on right now. So it is the minister who should really reassure the country. It is his ministry. So yesterday he was out in some of the entry points of the country, really educating people, making sure we have systems in place. So if he couldn't show up yesterday...
Why wasn't that communicated? Once he was invited, he could have responded to say, especially when the minority insists that the majority insisted, knowing very well that yesterday was not a regular sitting day for Parliament, that there should be a sitting. So if he was not available, same should have been communicated to save time.
I'm not privy to the intricacies of the issue, but the generality of it is that emergencies happen, especially when you're the health minister. You know, things can happen. Sometimes at 2 a.m. I get phone calls and I have to get up and put my toothbrush in my pocket and go and address some of those issues. So anything can happen, but I don't think it was a deliberate thing against Parliament. He's a member of Parliament himself.
Yeah.
So he's fully aware of his responsibilities, and I can guarantee you that the minority should rest assured that every question we have will come back and answer. If he's not there, I will come in and answer those questions on his behalf.
When should we expect that to happen? Or when are we likely to hear that official statement or official appearance in Parliament to answer some of the questions? Because I've gone through the order paper, and some of the questions are quite, I mean, all of it. You can't, you know, belittle any of them. When should we reasonably expect that?
It depends on the parliamentary schedule, because so it's the Parliament and the leadership of Parliament that tells you that come this day or that day. So if you don't, maybe yesterday because he wasn't there, it doesn't necessarily mean that today he can go, because now today they also have another schedule and they go to conclave and they decide what is the business, what to do when, and what is the business of the day. So that business of the day, I don't have any access to it. It is the parliamentary leadership, including the speakers, that really come up with what is the business of the day. So as soon as they communicate back to the minister that this day you're supposed to be there, I can guarantee you that he will be there. And so let's reassure the minority that it's not a deliberate thing, that the minister is available to answer any question that they have for us. And so that even sometimes the questions they ask is not even for the member who asked it. It is usually for not just the constituents, for the country, for Ghanaians. And he's a member, he's the Minister of Health for Ghana. I'm the Deputy Minister of Health. So they should rest assured.
While we wait, when government says we are prepared, what does prepared actually mean? And I want to have a clear picture of, for example, what could happen in the first 1 hour of a case being confirmed. There's no wood, there's glass, touch glass, in Ghana. What does prepared mean? Where are we?
So we're talking about emergency preparedness, and I believe you did the reference to Ebola. So as you know, the Ebola has started. We have places like DRC and Congo and Uganda, and we have seen cases. The WHO have declared it an emergency, but they haven't declared it as a pandemic or an epidemic yet. So for us in Ghana, so far we have no cases. So every Ghanaian should rest assured that there have been no cases found in Ghana. So what are our preparedness? So you're talking about how ready are we prepared? So we are looking at our entry points, right? So the entry point will be a place like the harbors, the airports, the borders. Those are the entry points where people will come into Ghana. At this juncture, in every entry point, we have emergency systems set in place where we're checking temperatures of people, especially people coming from high-risk countries. So it's basically not just about not everybody, like we did when it's true pandemic, like we did in COVID. Right now, we have to be more targeted. So people who are coming from high-risk countries, we are screening them, their temperature. If we find that anybody has a high temperature, regardless of what it is, because we know that the Ebola, the symptoms are almost similar to malaria type thing, because you can have a fever, body aches, sometimes you have a sore throat, and it is very non-specific. So if we pick somebody up at the borders who have high temperature, for instance, we have decontamination or Ebola preparedness centers that will take you and will monitor you for the next 24 to 48 hours. And then if we need to take sample, we have labs that we have designated as Ebola labs. When you go to...
Which ones?
I think it's Neguchi. Let me give you the specifics. It is Neguchi and let me give you... I have it. It's in here somewhere.
Who bears the cost of the testing?
Oh, the government bears cost of all testing, because we are looking, we have to be high surveillance. So we are highly surveilling the country, and so government bears everything. There's no individual payment or anything like that. It's only for us to ensure that we don't have Ebola coming to the country. So those labs have been designated as labs where they will be doing the testing. so that because they need specific PCR testing to test to see if the person has Ebola. If that person is found to have Ebola, then we have systems in place to where to put the person. So in every region, we have a disaster management team. And in every district in this country, we have disaster management teams. That includes clinicians, that includes the National Ambulance Service, it includes people like the clergy, like what do you call, elders of the community. And so those emergency preparedness teams have already been set up that before this epidemic or this looming issue came up. And so they have been set in place to look at, to make sure that they are surveilling every district as well as every region. If anything is found, we have put systems in place and protocols in place, and everybody knows. And the interesting thing is most of these protocols came up because of the COVID epidemic. Remember, the COVID pandemic. So the COVID pandemic taught us a lot of things. And so currently the country is very much in place. We are ready to make sure.
Okay, it takes care of the harbors and the airports. But we all also know the porous nature of our borders. The airports, yes, we can monitor and even contact trace. What happens to the other borders where surveillance is not as good, and not the established borders? Those ones that people just, manage to sneak in and out of the country from.
Thank you. So like everything else, it's not going to be airtight. And you all know that we have unapproved borders in the country. So that is why the public education comes in. So if you have a relative that has traveled, because you know how Ebola is spread, it's basically as a zoonotic disease. So that means that it is from the wild. It is usually bats and other primates that carry it. So when a human being gets in contact with those people, with those animals, like for instance farmers and let's say hunters and people who see maybe dead animals, and then they come into contact with secretions and parts of that animal. Now the animal transports it, or I don't even know the word, it's a communicable disease. So now the person who transmits it to that person, once it's transmitted to a human being, now it becomes a person-to-person contact. So if you come in contact, or I come in contact with a person who has Ebola, then I would also I will have Ebola. So the public education that we're doing in the districts and in the regions is that when you have a family member that is known to have those kinds, something who is a farmer who goes out, or who is a hunter, comes back with that kind of disease, you have to be careful. Now, like we did with COVID, hand washing, proper hand washing, wearing the appropriate PPEs, making sure that they bring that thing to health facilities, so that the health experts in that district or in that region are fully aware of it. That is the teaching and the protocols that we are putting out there within every district in the country, as well as every region. So our surveillance level is very high. We can't close every border, but we can also educate the people. We are educating the religious leaders, we're educating the chiefs, we're educating community elders, because this Ebola, they are all part of the system that will really prevent us from having Ebola. Remember that I believe in 2015 or before 2012, somewhere between 2012 and 16, there was another Ebola crisis, and it didn't end up coming to Ghana. So hopefully this is what is going to happen this time around. And even this particular strain and this particular outbreak is not as wild or as much as the last.
Is it concerning, though, that the World Health Organization thinks that the vaccine for this particular strain, and there's a name for it, I've been trying to learn to pronounce it since morning.
I have the same
Bundibugyo strain.
Yes,
so there's a concern that there's no vaccine, approved vaccine for that particular strain of Ebola.
So because there's no approved vaccine, that is why we have our surveillance systems have to be very high at all points of entry. We have all the health facilities, both private and public, have been educated. They are all looking out for any kind of disease that is a suspect. Our rapid response teams, like I mentioned, in the districts and also in the regions have all been activated. There's coordination not just between the Ministry of Health, but the Ministry, Ghana Health Service, our international partners, WHO, CDC, Africa, every other relevant institutions.
Ghana Infectious Disease
Ghana
Center.
Infectious Disease Center is one of those labs that we are saying that they will really check. We have 4 labs, and I'm still trying to find. I know Noguchi is one of them, and these are the labs that have been designated to test the samples.
Okay.
Because we have to ensure that the samples, when they come, that they are actually true tests that come up and say that the person is actually positive, so that we can take it from there.
That first positive test, the medical field call them patient 0.
That is correct.
If we get that, we don't want, but if that should happen, that one person perhaps is picked up from one of the entry points. Straight away, what are some of the triggers that will be activated? Because it will no longer be a hypothetical situation. By that point, we may very well have recorded the very first case. So what happens then?
So just like we did with COVID, that person will be isolated, and we have isolation centers in the country, depending
across the country.
Across the country.
Sometimes there are concerns about Accra being always the focal point. The major cities always being the focal point at the expense of the smaller districts and communities.
But when it comes to Ebola, it has nothing to do with Accra. We are looking at the country as a whole, and most of our entry points are not even in Accra, maybe except for the airport. Most of our entry points are in other, like Western region has Elibo, Aflawo, which I'm actually even going on a site visit. My minister told me yesterday to go on a site visit. We are still deciding what day to go to ensure that the systems that we are putting in place is actually in place. So it's not about Accra. It's about the nation as a whole. We are looking at all the entry points. If that patient 0 comes, the first thing you do is isolate that patient 0 and then treat symptomatically, because it's about the incubation period is about 2 days to 21 days. So it is only even at the 21 days when the person is symptomatic that they can transmit it to another person. So we know the life cycle and the history of the virus. And so what we want to do is isolate the person. And remember, during the COVID time, when we call the contact tracing. So immediately, if we pick it up, then we have to do contact tracing. You know, where have you been the last time? How did you enter? Then we do the immediate surveillance that we have picked up now. The next step is who are the contacts of the person? Because again, it is spread contact person to person through contact of maybe bodily fluids, as well as maybe contaminated surfaces, bed sheets, and all kinds of things. So the next step will be who are the contacts. Then they also be isolated. And once the contacts are isolated, what you do is the incubation period, like I said, is 2 to 21 days.
And they will be taken from their homes?
They'll be taken from their homes.
To these isolation centers
that we've identified. Then once we observe them for 0 to 21 days, if they have no symptoms, that means they never really contacted the disease. But if they do, then we would check their contacts, because again, it's a person-to-person transmission. So who is the contact of that patient 0? And that is how we normally, that is basically how we will curb the disease and make sure that it doesn't spread.
How available are PPEs? Because COVID taught us a painful lesson about shortages and hikes in prices because of those shortages.
Thank you. That's a very good question. So because of, like you said, the lessons we learned from COVID, the WHO Afro, which is WHO Africa, Africa CDC, the government of Ghana, we have like a stock of PPEs. So we're not going to wait.
Not just the nose mask?
Not just the nose mask, the full PPEs, because the people that it's a bodily contact thing. So, and we know that that's the mode of transmission. So the gowns they're wearing, the gloves, the goggles, the nose mask, the covering your hair, covering everything, the shoes, and the isolation PPEs, we have all that.
We won't need emergency procurement?
No, not yet.
for the next few weeks, for the next few months?
We have a stock, and hopefully it won't happen. But if it does, as I said, with the proper contact tracing, proper disease surveillance, proper symptomatic treatment of those who are ill, who are found to have it if they do, and then knowing the incubation period, there's a lot of clinical things we can do to avoid a widespread. So for me, I continue to reassure the good people of Ghana that first of all, we will avoid entry into the country. And second of all, even if we do, we have all the systems set in place to avoid a widespread disease. And so it won't, I truly believe that it won't happen. But it is only up to our preparedness, and I truly believe that we are fully prepared.
The health care workers are already overwhelmed, and I have a few questions from our screens that I'll be asking about the nurses and new people who want to now be employed and all that, and what the ministry is doing about that. But how refreshed are the healthcare workers going into this threat and this alert? Do we have the trained infectious disease specialists, the epidemiologists, and all those people refreshed enough to tackle this head on?
Oh, yes. Like I said, we do have all these people trained already. So it's not now that we're going to find people.
They are not being given refresher training to be ready for this particular one?
The rapid response team are always being refresher trained. So it's not like you wait for the epidemic to come or the pandemic to come before you start training. We have set up these teams in every region and every district called the rapid response team. They are existing whether Ebola is in the corner or is not. And they are constantly being trained so that they can identify these issues when they come within that particular district, as well as within that particular region. So all our regional health directors are aware, all of our district health directors are aware, every region or district health directors team is ready to address the issues. Now, if something comes like you're talking about patient zero, where, we have stock available in country now to solve the problem. So it wouldn't be the nurse, for instance, that enters for instance, an emergency room, and perhaps, let's quote unquote, maybe the person has slipped through and is at the emergency room. Once the nurse suspects that thing, there's a district disaster team as well as a regional disaster team. Before even the national disaster team comes into place, we have set up systems in place to manage the crisis because of the lessons we learned from COVID. We are not going back from COVID. We are learning we learned lessons from COVID, and we are building on those lessons. So our disaster management teams doesn't only come up when there's a looming disaster. It is an existing group consisting of clinicians, national ambulance, nurses, doctors. It's a whole group of people that are managing this issue. So I truly believe that it will not enter our borders, and I truly believe that even if it does, Ghana is very prepared to manage this issue when it comes up.
With all that coming together, we know that there are still vulnerabilities. What do you think is Ghana's biggest vulnerability in this Ebola preparedness?
I think that our biggest vulnerability will be, like, I think you had mentioned it, the leaking borders, where people entered through unapproved entry, and now they are in the country. But because of that, that is why we have alerted all of our facilities, health facilities, not just government facilities, but private facilities, because that first patient might end up in a private facility or a government facility. And not only that, we have even sensitizing the traditional leaders or even the herbalists, because that person could end up from a herbalist. So all those sensitization is currently ongoing, so that if you identify a case, where to take it, who to call, numbers to call, emergency numbers to call, and the disaster management team is already in place to manage it.
I wish we could put some of those numbers out now or by the end of this interview, so that people know exactly whom to call, where to go, if they do find a suspected case, and so that you know where you can get help. But Minister, is this all already paid for? You said that the ordinary Ghanaian or anyone who is suspected to be at risk of being infected or having been infected will not pay anything. So the government has picked up the bill for this. Is there a fund? Is there a figure that we're working with on how much this preparedness and prevention drive and potential treatment process could take us?
The country already, again, because of the lessons we learned in COVID, we already have emergency preparedness fund. We already have emergency preparedness, even facilities. We already have emergency, even the labs, if we have to scale up on, for instance, the samples that are coming is too much. If in the past you were doing 6 samples and now because of a crisis, you are doing like 25 samples. We are able to quickly scale up and we are able to quickly control and the spread and treat and get rid of it. So it is nothing new. All these systems are already in place. Now we have to be hyper alert, and our surveillance is where we have to be hyper surveillance. And we are there now, and we are surveilling all of our entry points, including the airport, even including the harbors, as well as the borders. But again, our vulnerability might be the areas where people are entering the country and they are not approved borders. But even that, we have put systems in place. Some of them we know about, some we don't know. But even those we know that this is a leaky area, we have sensitized the area that if somebody comes and the person is sick, you know, because the high-risk person will be the caregiver of the person who has Ebola, the suspected case. So that high-risk person, if you have a suspected case, you will know what to do. We have sensitized the local community elders. We have sensitized the chiefs of there, the queen mothers, and we are continuing. This is not a one-day thing where you go to stand somewhere and you talk and everything is over. It's a constant thing that there is a looming problem out there behind our borders, and so let us be more vigilant. And if it comes, these are the steps you have to take. And so we are very vigilant, and we will make sure that just like the last time, I don't think it's, even in DRC, the cases are not as much as the last Ebola crisis. You know, there are 3 types. There's the Zaire Ebola, the Sudan, and this one I can never mention the name.
Bundibio.
I can never. Yeah. I can never really pronounce it.
What are the chances of getting Ebola from Ghana? Because there are some communities very, very close to this place. There's a whole bat situation around the 37 military hospital, and bats have always been one of the leading names of mammals we mention when Ebola is concerned. What are the chances of going through a place that has a large bat population and contracting Ebola if any of them happens to make contact with you?
Thank you. But remember that it's not every bat. You know, the virus doesn't live in every bat. And so far in Ghana, we have not identified any bat that carries the Ebola. That is why even this issue didn't start from Ghana. It started from elsewhere, DRC and elsewhere. So in Ghana, so far, we haven't identified any bat that has Ebola, or anybody has come, or the patient 0 is not here. Ebola currently is not in Ghana. So our job as the ministry and our job as the government is to ensure that it doesn't come into the country, to make sure that we have closed all the plugs along the way, and even if it comes, what are the steps we take to prevent a widespread pandemic. So those are the steps. It's more the surveillance and early recognition, and then early identification of the contact of that person, contact tracing, and then early treatment, because we know that, I think last week I heard that 4 nurses or 4 frontline workers have been discharged home from Ebola. Yeah. So if you identify it early and put systems in place early, even people can recover from Ebola.
All right, because we are or again on an education drive. Doc, walk us through the symptoms of Ebola once again, what to look out for, and when to report at a health facility if anyone experiences those symptoms.
So, as you saw, is contact. So basically, the first phase, the early phase of this Ebola, it's fever. It almost, to me, sounds like malaria, because that is where the early identification helps, because it is so non-specific. You have the fever. Some people have headaches. Some people have sore throat. They have body pains. So you can't tell whether it's malaria or it's not malaria. So it mimics a lot of other things. Once we are able to, so that's the phase 1. Now phase 2 goes into further. That means that you've gone past that incubation period, 2 days to day 21. Now you start getting into where your organ failures, the kidneys failing, other organs are failing, you're having heart failure. And then before, there's Zaire, there's 3 types now, and we are talking about the BVD one. That one is different from the Zaire. The Zaire one, or the Sudan and the Zaire, were the ones where people will start bleeding. From all orifices will start bleeding. In this particular strain, the bleeding is not as much as the Zaire and the Sudan. So it's going to be almost a non-specific start, and then as it graduates, it goes into where you start getting multi-system organ failure. So once you pass the multi-system organ failure, now the case fatality goes up, and now you're more likely the death comes in. So those are the basic symptoms. So if we're able to pick it up early during surveillance, then we bring that person who has the fever, the body pains, the sore throat. Sometimes they get into diarrhea, and they have diarrhea, so almost like cholera as well, almost like malaria. If we are able to isolate that person in the first, after the 21 days, for another 2 weeks or so, and we are able to treat the symptoms, so symptomatic treatment, they can survive and now go home, even though they had Ebola. So it is about the early diagnosis and the surveillance and the early diagnosis, so that we can bring them into isolation centers and really treat them well. So, last week, I believe, or this week, 4 nurses who had Ebola, I believe in DRC, were sent home, recovered and went home.
Now, we'll touch on a couple of other matters before we rise from this table. The plan to ensure that we have a system that retains the doctors, the nurses, the healthcare professionals that it trains. And I've heard the response where they said we can't stop anybody from leaving the country, but the government also has a responsibility to ensure that the skilled personnel are available to treat its population. What's the plan? Because there are nurses and doctors at home, especially nurses, who are waiting to be employed.
Thank you. This issue, I think we need a whole session to discuss it. See, when we came into government, which is now maybe a year and 6 months, there was a huge backlog. I believe that we have, if not 50,000, we have about 70,000 nurses at home. So starting from 2020, 21, 22, 23, 24, they have not been hired. So they will go to school, they will pay alawa for them to go to school, the stipend that they get. I think some of the nursing schools are, the government helps them, supports them for the payment, and then as they finish, they come and they sit at home. So we are looking at a backlog since 2021 at least. That's not just the nurses, but we also have a backlog of physician assistants. We have a backlog of allied health workers. We have a backlog of what's the people that biochemists. We have all of them at home. So as the new government, as the Mahama government comes in, we have this backlog. Now, what is the solution? The solution is we have to be innovative and find other ways to hire all these people. As we speak right now, we have just finished hiring almost, I think, 16,000 nurses all kinds of allied health. Besides the fact that some people were at home, there are other people also in the system, some of which have worked 10 years, 8 years, 9 years, 5 years in the system, and they are being paid with IGF. So internally generated funds is paying them. So they are not even on the government payroll. Whilst at the same time we had gone to an IMF, and we're under IMF conditionalities. So the problem we met was a very deep and complex problem. But President Mahama said, President John Dramani Mahama, I came to meet all these problems, but we're not here for lamentations. We will solve the problem. So our solution to the problem, even though we're not going to hire everybody at one time, because again, somebody has to pay them. And as you know, we just got out of the last IMF conditionalities or the IMF loans that we took. We just literally, has it been a month?
And we are still under supervision.
And we are still under supervision. So we have to manage fiscal responsibility as well as ensuring that we can bring a lot of those people at home. So we know the issue and we are solving it. Currently, like I said, we've hired almost 16,000. Guess what year? 2021 group.
So the rest should not have.
So the 16,000 is the 2021 group. As we go along, we'll get clear. And now, before they used to hire them and then they wouldn't get clearance. Now we are getting the clearance before we even bring them in to apply. So besides the fact that we're going to systematically hire them, I think that the last time I heard the minister is that at least every year, if not more, we can do a basic of 25,000. Because we know the numbers at home.
Okay.
Now, if we are able to do that, that is just for internally. As we open up more health facilities, as we build more high-level health facilities,
Agenda 111
as Mahama
project.
Care, Agenda 111, there's not even one Agenda 111 hospital that is functional as we speak today, that somebody can get up and go into an Agenda 111 hospital. But there are places like this place in Kaswa, I believe, the mother or child hospital, that a World Bank project, there were some issues with procurement issues under the previous government, and now we are in negotiation to see if we can open it. Ghana Health Service will bring us the staff there. So those are some of the things what we are doing internally to hire them. But besides that, we also have something called managed migration. What is managed migration? Because we have this huge backlog, we need to find a way, innovative ways, because traditional ways would be government to hire all of them, which of course we are under IMF supervision, which of course you know that even the country, by the time we got into this government, all of our statutory monies were gone, the ESLA, there was nothing there, and they had mortgaged us into a depression.
And you said you would fix it, and Ghanaians.
Yes, so we are fixed. That is why we are fixing it. That is why we are fixing. We are here. We don't lament. We come in to fix. But that means that you cannot also hire all of them today. That means that you have to have a plan. So part of the managed migration is that we have almost 13 or 15 countries that want to partner with us. The Minister of Health from Jamaica just left, I believe, 3 days ago. And the issue is that we can share resources. They need the nurses. We have excess. St. Kitts and Nevis came. They need the nurses. We have excess. When you go to Europe, most of the nurses there are Ghanaians or Nigerians. When you go to America, most of the nurses and the hospital staff are Ghanaians and Nigerians. So the issue is that why don't we come to agreements with them so that we can export them, but we're not exporting them for forever.
Okay.
And we can have some sort of a reciprocity. We train them, you take them. Even as you're taking them, maybe you can, as you're supporting the particular healthcare worker, you are also supporting the country that is training them, because it costs us money to train them.
Thank you, Doc.
So you know that almost 100 and something people have already gone to Barbados. But Bahamas is coming up, Jamaica is coming up, St. Kitts and Nevis, we are already done.
And it will be fairly.
It will be. We open up a portal. You go and you apply.
Doc,
Once you apply, you come for interview. They will ask you questions. You yourself, you will answer, because not everybody wants everybody either.
Okay.
Politics isn't just about power. It's about you, your family, your future. Current Agenda will reflect on the policies shaping our world, challenge the leaders who make decisions, and hear directly from you. From the capital to your hometown, we deal with the issues that matter most head-on: the economy, healthcare, climate change, social justice, and many more. Accountability isn't optional, it is essential. Current Agenda, with in-depth analysis, thought-provoking guests, and your views, we empower you to be part of the solution. Every Saturday morning, 7 a.m. to 10 a.m. Current Agenda. Your voice, your power.
Hello, you are with me, the voice of ability for persons with disability. United Nations statistics estimate that over 600 million people live with disability globally, and over 400 million people live with disability in Africa. 40% of Africa's population are made up of people living with disability. 10 to 15% of school-age children in Africa live with disability. Ghana's population is over 32 million, and 8% are people living with disability. How does this impact on persons with disability in terms of policy formulation, marriage and family life, education, healthcare, employment, and so on? For those of us in the disability community, discrimination and stigmatization is the root cause of almost every challenge we face. However, success only comes to those who know how to overcome their challenges, and not those who know how to avoid challenges. So join me, the voice of ability and for persons with disability, as I navigate my way through the riveting stories, the unbelievable experiences, and the life-transforming journeys of persons with disability on the Helping Hand TV show.
In Touch is a life-transforming biblical series that touches on in-depth lessons about the life of Jesus Christ, leadership, life's principles. This program is brought to you by Charles Stanley, founder of In Touch Ministries.
It's Tuesday, June 2, 2026. Good morning. Welcome to News Highlights right here on GBC News and on GTV. Your News Highlight to bring you top stories making headlines. Remember, we also stream live on Facebook at Ghana Broadcasting Corporation. I am Samuela Korte. President John Mahama has called for renewed regional cooperation to address the growing insecurity in the Sahel, warning that instability in the region poses a significant threat to peace and development across West Africa. Speaking at Chatham House in London on Monday, the president stressed that the dangers posed by terrorism, violent extremism, and political instability in the Sahel states require a united and coordinated response from countries within the region.
Ghana has recently signed a defence security deal with the European Union. I was wondering what you thought the European Union and the UK could do to help the question of security in Western Africa.
Actually, the partnership we signed just formalizes a very excellent terrorist activity, and 3 of our neighbors, which are the Sahelian nations, are bearing the full brunt of terrorist activity. The situation is particularly difficult in Mali, but it also affects Burkina Faso and Niger. We had previously a framework for cooperation in the fight against terrorism, which was called the Accra Initiative. Unfortunately, with the souring of relations between the Sahelian states and the ECOWAS, which led to the formation of the Alliance of Sahelian States, the Accra Initiative has virtually been abandoned. And so what I've done since I became president was to seek new pathways and build new bridges for cooperation between ECOWAS and the AES states, because after all, terrorism is not a threat to only one nation, it's a threat to all of us. And so we need to work together. It moves
right across borders.
Exactly. And so it needs international cooperation to deal with it. And so for Ghana, our attitude has been to cooperate with everybody who is interested in the fight against terrorism. So we have relations with the United Kingdom. We share intelligence in terms of terrorism. We do joint exercises, training programs with the UK, with Germany, with France, with the United States. Yeah, and I think that's the way to go.
President John Dramani Mahama has underscored ongoing regional efforts under the Accra Initiative as part of a broader push to address escalating insecurity in the Sahel, urging stronger coordination between ECOWAS and international partners.
How in practice does that work? How can you get some kind of dialogue with those three?
When I came to the presidency, I met an atmosphere of distrust. The Sahelian states had just broken off from the ECOWAS and declared their confederation. And ECOWAS there was no talking with each other. Indeed, the atmosphere was adversarial. And so the first thing to do was to convince ECOWAS that it was not the way to go, and that we should reach out to them. And so I paid a first visit to all three states because I had invited them to my inauguration, and they very, very graciously attended. Happily, the relation has thawed, and I think that there's more, discussion and contact about our common future between ECOWAS and the AES states. There are many countries with an interest in what is happening there. One, the collapse of Libya Gaddafi in Libya contributed to what is happening there, because it became a conduit route into the Sahel, especially when a lot of terrorist groups were eliminated in the Middle East, in Syria and other places. They found safe haven coming through Libya into the Sahel. Now what happened was the Tuaregs in Mali had a grievance about marginalization, and they had started asking for an autonomous region that they call Azawad. And so that discussion had been going on and the tensions existed. Now what has happened is these other groups, Al-Qaeda groups and all of them, ISIS, have come and exploited the legitimate grievances of the Tuaregs, and that has been the point of entry. But we cannot have peace in the Sahel without involving Algeria. We cannot have peace in the Sahel without involving Mauritania. And so I think that it must be a larger discussion than just ECOWAS.
The Ghana Education Service has released the academic calendar for senior high schools and senior high technical schools for the 2026-2027 academic year, outlining schedules for both single-track and transitional schools. In a statement issued by the GS on June 1, the GS urged parents, students, teachers and school administrators to take note of the dates and prepare adequately for the upcoming academic year. Under the single-track system, Form 1 and Form 2 students will begin the first semester on September 18, 2026 and remain in school until January 29, 2027 before proceeding on vacation until March 29, 2027. The second semester will run from March 30 to July 30, 2027. Form 3 students in single-track schools will start classes on September 18, 2026 and end their first semester on December 18, 2026. After a vacation period ending January 31, 2027, they will return to school on February 1 and complete the academic year on June 18, 2027. For transitional schools, Form 1 students will alternate between in-person and online learning. They'll begin in school studies on September 18, 2026, before moving to online learning from November 16 to December 18, 2026. Now, following a break, they will return to school from February 8 to April 16, 2027, and resume online learning from April 19 to May 14, 2027. The second semester for Form 1 students in transitional schools will run from June 21 to August 27, 2027. Form 2 students in transitional schools will start school on November 16, 2026 and continue until February 5, 2027, followed by an online learning period from February 8 to March 5, 2027. Their second semester will commence on April 19 and end on August 27, 2027. Form 3 students in transitional schools will attend school from September 18 to December 18, 2026, then resume classes on January 5, 2027, and completes the academic year on June 18, 2027. GS also announced that the Christmas break will run from December 19, 2026 to January 4, 2027, while the Easter break has been scheduled for March 25 to March 30, 2027. The West African Senior High School Certificate Examination is expected to take place from April 6 to June 18, 2027, while a mid-semester break for Form 2 students has been scheduled for June 17 to June 20, 2027. It's still news highlights right here on GBC News and on GTV. Remember, we're also streaming live on Facebook at Ghana Broadcasting Corporation. The Speaker of Parliament, Mr. Obon Bagman, has called a meeting of the leadership of the House following the passage of the Human Sexual Rights and Family Values Bill. The Speaker says the legislation requires broader consensus and stakeholder support to ensure its successful implementation and public acceptance. The Speaker made this known during a media briefing ahead of the 4th African Inter-Parliamentary Conference on Family, Sovereignty and Values. The Parliament of Ghana is hosting the event.
You know the copious instruments and laws on human rights. All over. We have to go through all, from the UN Charter to the African People's Rights and what, all. We have to go through all. Then we have also our development partners who had a lot of contribution to make. We had the United Nations coming in with proposals, some memo and everything. We as Ghanaians also have to dig deeper into our cultures, our customs, our values before we came out with what was passed on Friday. And in fact, when it was passed on Friday, it was even a surprise to me, because I know that they were going to start the consideration of the bill. And that was the instructions I left before I went to attend to other activities. And so this evening, I have asked the leaders to meet me in my office. So they will be here for us to go through it. This is such a critical bill that we believe there must be consensus. But it's not about passing bill. It's about implementing it and making sure that it benefits the people.
The minority in Parliament is pushing for a return to the original Human Sexual Rights and Family Values Bill, arguing that amendments passed by Parliament have stripped the legislation of its intended strength. At a media conference in Parliament on Monday, June 1, 2026, the sponsor of the bill, Asin South MP, Reverend John Intimfojo, accused the majority of smuggling in some clauses. He described the revised version as a watered-down law that no longer serves as a strong deterrent. He insists Parliament must restore the original bill in full.
Was a promise to come and amend, review, mutilate, alterate, dilute the bill before he signs. You all remember. The promise was clear. Vote for me. I will come and sign the bill. On all their platforms, they said, vote MPP out because they won't sign the bill. Vote NDC NDC will come and sign that bill. They did not say NDC will come and amend that bill. NDC will come and review that bill. NDC will come and delete provisions from that bill and redraft it before we sign. That is a scam, and that is breach of trust. That is deception, and that is hypocrisy. So today, instead of President Mahama to assent to the same bill we passed in 2024, they have changed it extensively, and what they have today is materially different from what was passed in 2024. Substantially different. You can't subject a bill to 22 deletions and 31 insertions, total of 31 amendments, and expect that the bill is the same. You have overhauled it. It's just the title that is the same, and you all agree. If the old bill was truly ready for President Nana Addo Dankwa Akufo-Addo to sign, and if they sincerely believed in that bill, why was that same bill not placed before President Mahama, His Excellency John Dramani Mahama, the same form for him to assent? Why did they now have to water it down?
Now, the rainy season is here, and the Ghana Meteorological Agency has already warned that Ghana could experience above normal rainfall this year, especially in parts of Accra and other coastal areas. The agency says the peak period is expected around June, with possible flooding and thunderstorms in some communities. But beyond the floods and road accidents, another major concern during this period is fire outbreaks, from electrical faults to unsafe wiring to the use of generators and lightning-related incidents. Joining us to discuss how we can stay safe during the rainy season is the Public Relations Officer of the Ghana National Fire Service, DO2, Desmond Aka. Good morning, sir, and good to have you on News Highlights. Good morning and good to have you on News Highlights.
Good morning and thanks for having me.
I hope you are doing well.
By God's grace.
How prepared is the Ghana National Fire Service for the peak of, this year's rainy season?
Well, let me first of all say a very good morning to your cherished viewers. In terms of preparedness, the Ghana National Fire Service is very much prepared. I mean, earlier or previously, even before the rains even started, we did a lot of joint simulation exercises with other emergency response agencies. So in terms of equipment, in terms of capacity, in terms of personnel to deploy when our services are needed, when the flood comes, we are ever ready to save lives and then salvage property. But beyond our preparedness, I think that we need to put things in perspective. Before the floods, there are things that we need to do. During the floods, we need to also do certain activities to keep ourselves safe. And then beyond the flooding, what we can also do to avert our homes and premises from being affected by these flood waters. So in putting things in perspective, I think that the Assembly should help us, especially in granting permits for people to build in waterways. Once that thing is curtailed, it means that places which are not supposed to be used as residential or whatever property development would be reserved for the excessive water that would be made available as a result of the rain, would also be find ways to kind of not become destructive when the flood would want to come. And then also those of us who live along drains, who would want to put debris, waste, and other kinds of unwanted materials in such drainage, we should also advise ourselves. If possible, we can also do some clearing, desilting. I mean, it is in order in order to ensure that when the rain or the runoff comes, they would have safe passage without causing any havoc. And then also, those of us who live in flood-prone areas, it is now time for us to reconsider relocating, because now we have been given adequate information that the rains are going to come and they are going to come heavy. And therefore, the precaution to take is to leave that place, go to a place which is a bit higher, which is not affected normally by these flood waters, so that we will not have lives put at risk when the flood comes. What we can also do before the flood comes is that we could also do get some competent electricians or engineers to assess our premises to ensure that our wiring, our electrical installations are not compromised in any way, such that if there is any fault, they will quickly assess it and then rectify the issues, so that in case of the heavy downpours, we will not have electrical fires that are normally associated with the rainy season. And then also those of us who will be using generator sets to power our premises, it is important that we put them outside our premises, such that it will not accumulate the carbon monoxide that will be generated when it is being used, in order to not to cause any havoc to us. And then in the course of the rain, we should always be mindful to kind of stay updated with the weather updates, especially from the Ghana Meteo, so that we can use the information to plan our day, so that if we know that it's going to rain at a certain time, quickly, if we have something to do in town, we dash out, we get it done, and then we come home as quickly as possible to avoid the rain and then possible floods that would affect us in one way or the other. And then also, when the rains are coming down, we shouldn't be sending our kids to be going to fetch water, especially with this aluminum basins and all that, because there could be lightning activity that could also affect our children having be using these aluminum or metal containers in the course of fetching water. That could also affect them. And those of us who live in these glass premises, we should also stay away from these glass or shiny surfaces when the rains are coming with lightning activities, such that we will not be affected by these lightning activities. It is also proper that when we are watching TV and there is heavy downpour interspersed with lightning activities, we off our TV and then we unplug it from its receptacle, so that the lightning will not affect the antenna and then send the excessive current through the antenna cord into the TV to create havoc. Once we are able to do these simple things, I believe that electrical causes of fires will be greatly reduced, so that we will not have any bigger issues. And then also within our community, if we find any electrical hazard, maybe there is a pole that has been compromised, electrical utility pole with wires that has been compromised, we need to be able to report to authorities, such that the necessary remedy will be put in place in order not for the rainstorm to come and then these utility poles will fall on our premises and create fire situations. If we also live around areas where we have a lot of trees, which are kind of interfering with these utility poles, it is high time you call on the Ghana National Fire Service or the nearest assembly to come in to trim these tree branches, such that if there is any rainstorm, the tree branches will not interfere with these power lines in order not to create any fire situation for us. So by and large, when there is any rainstorm and we suspect that our place will get flooded, that is how come our emergency number 112 or any of our hotlines has been made available for the public to call as soon as possible, so that we can also come in to save lives and to ensure that properties that would have otherwise been destroyed by the flood waters will be curtailed. Those of us who believe in our vehicles and during rainstorm, we would want to drive through the heavy runoffs that are running across our trees, streets, and other places. We should be mindful. It is important that you park at a safe place. You ensure that the rain reduces or the water subsides before you make a safe passage. There could be a compromised bridge ahead of you. There could be an issue whereby your vehicle cannot move through those heavy runoffs that are produced by the flood waters. And therefore, once we are able to do that, by and large, we will not get ourselves into trouble. And then the flood waters will also not affect us in any way.
Aside, dialing the emergency numbers in case of emergency, what should the public do first, before the gallant men arrive when there are emergencies?
So what we can do when our premises are affected by flood waters is to move to higher grounds. If, let's say, our premises is a story building, we can find ourselves on the upper floors. If we have a reflective kind of clothing, we could also wear. If it is in the night, and then we have some flashlights around, we could also put it on and be flashing it around just to give emergency responders some form of signals so that we can see where you are and then approach with the aid of our rescue lines, with our ladders and then our pumps to come to your aid to ensure that your life is not put into harm's way. And those of us who have documents in our possession and then we have virtually nowhere to go, it is proper that we look for watertight or waterproof containers to be able to store all those important documents, such that when our place is even flooded, it will become very difficult for the flood waters to get those important documents destroyed. And then also, once we know that our place is flood prone, what we can also do is that once the rain starts, we can put off all our electrical gadgets. If possible, we can switch off the mains so that even if the flood waters come and they are able to permeate our wall sockets, enter through our receptacles, it will not create any havoc during that period. And then if you call the emergency number, which is the 112, and you are not getting through to us, you can reach us on 030-277-2446 as quickly as possible so that we can come to your aid.
Thank you very much for those safety tips. So that was the Public Relations Officer of the Ghana National Fire Service, DO2, Desmond Akam. Now, the Upper West Regional Police Command has arrested 2 suspected robbers in connection with the robbery incidents that occurred along the Tumu Korea Road in the Sisala East District on May 30, 2026. The suspects identified as 20-year-old Seydou Muzu and 22-year-old Salifu Mutada are alleged to have robbed 3 persons at gunpoint and made away with an unregistered Absonic motorbike. According to a statement signed by ACP Peter Kamasa, Deputy Regional Police Commander for the Upper West Region, a swift intelligence-led operation by the police led to the arrest of the suspects and the recovery of the stolen motorbike. Further investigations resulted in the retrieval of an unregistered Logia motorbike believed to have been used in carrying out the robbery. Both motorbikes have been impounded to assist ongoing investigations. Police say preliminary information suggests the suspects may be linked to a series of robbery attacks that have recently terrorized residents in Tumu and surrounding communities. Investigations are therefore being expanded to determine their possible involvement in other criminal activities reported in the area. The suspects are currently in police custody assisting with investigations while efforts continue to recover the firearm allegedly used in the robbery. The Upper West Regional Police Command has commended members of the public for their cooperation and urged residents to continue providing timely information to support efforts to combat crime in the region. Also in this package, the Ghana Institution of Engineering has called for a radical overhaul of Ghana's flood and stormwater management systems, warning that existing drainage infrastructure can no longer cope with rapid urbanization, climate change, and increasing flood risk. The institution said the country must urgently move away from traditional drainage approaches that focus mainly on channeling stormwater downstream, noting that such systems are now outdated and ineffective, especially in fast-growing cities like Accra. The Ghana Institution of Engineering explained that flooding in Accra is no longer just a seasonal problem, but a structural challenge driven by urban expansion, poor land use planning, reduced natural drainage areas, and increasing rainfall intensity. It's added that many drainage channels are now clogged with waste, significantly reducing their capacity to function effectively. According to the institution, repeated flooding incidents in recent years, including cases occurring even during low rainfall periods, show that the problem goes beyond climate variability and reflects deeper weaknesses in Ghana's stormwater management systems. To address these challenges, the institution is proposing a shift towards decentralized and nature-based stormwater management systems. The Ministry of Gender, Children and Social Protection has renewed calls for greater inclusion in menstrual health education and improved access to menstrual hygiene products, especially for women and girls living with disabilities. At this year's Menstrual Hygiene Day commemoration in Accra, stakeholders stressed the need to break stigma, promote dignity, and ensure that no girl is denied opportunities because of her menstrual cycle. Giftia J reports.
Menstruation is a natural biological process experienced by millions of women and girls around the world. Yet for many, it remains surrounded by stigma, misinformation, and barriers that affect health, education, and social participation. To spotlight these challenges and advocate practical solutions, the Ministry of Gender, Children and Social Protection joined global efforts to mark Menstrual Hygiene Day at the Accra Rehabilitation Center. Observed annually on May 28, the day seeks to promote menstrual health awareness, improve access to safe hygiene products, and encourage open conversations about menstruation. Speaking at the event, the Minister for Gender, Children and Social Protection, Dr. Agnes Namomo-Latte, expressed concern that despite growing awareness, many girls continue to face discrimination and misconceptions surrounding menstruation. She noted that the situation is even more challenging for girls and women with disabilities who often encounter additional barriers in managing their menstrual health with dignity.
Millions of girls are compelled to miss school during their menstrual periods, while many vulnerable persons face exclusion and embarrassment simply because they menstruate. For women and girls with disabilities, these challenges are often compounded by barriers to accessible information, inclusive sanitation facilities, healthcare services, and social support systems, thereby deepening inequalities and limiting their full participation in society.
Chief Director at the Ministry of Gender, Children and Social Protection, Dr. Marian Pakpa, called on families, schools, health institutions and community leaders to help create a supportive environment where menstrual health issues could be discussed openly and without shame. A midwifery officer at the Greater Accra Regional Hospital encouraged society to normalize conversations around menstruation, describing it as a health and a natural part of life.
We should talk about the need for people to stop discriminating against people who menstruate and then they soil themselves. It's a natural thing and you should be proud about it.
As part of activities marking the day, sanitary pads were distributed to beneficiaries to help improve menstrual hygiene management and reduce challenges associated with accessing menstrual products. Reporting for GBC News, Gifty G, Accra.
In Otujo, a quiet corner of Dansoman in the Ablekuma West municipality, the fight is not just against rain, it is against trash. Residents are raising their voices and they are tired. Day after day, tricycle riders roll in and dump refuse straight into water channels and protected wetlands. These are the very spaces nature set aside to shield the community from floods. But the buffers are disappearing and the piles of waste. When the rains come, the water has nowhere to run. Channels that should carry it away are choked. Wetlands that should soak it up are smothered. So the water turns back on the people, creeping into compounds and homes. From Otujo, flooding is no longer just an act of nature. It is the cost of what gets dammed when no one is watching.
Dansoman Otujo sits quietly in Accra's Ablekuma West district. But when the clouds gather, quiet turns to panic. This community lives on edge. One heavy downpour and the streets are underwater. Flash floods do not knock here, they barge in. Now Otujo is in the headlines, and the reason is not just rain. At the center of the crisis is trash dumped with intent. Tricycle riders roll into water channels and protected wetlands and empty their loads. These wetlands were supposed to be the community's shield. Residents say the blockages are not a mystery. Refuse is the first culprit. Unauthorized buildings on waterways are the second. Together, they have strangled the flow. The warning signs are everywhere, and the people have been waving them. They want authorities to step in before the next rain turns their homes into drains.
Since the thing started from Wedagbawu municipality, we are calling on the MCE of Wedagbawu to immediately stop dumping of refuse, because it is only the assembly that can give you permit or can give you approval to dump refuse. So we will not say that it is Mr. A or B. What we say that it is the assembly that is doing the dumping of the refuse. No problem. No me complaining. No kanye ba ko ka ayema lele na ayema bola jinema ke sama lu akabola sama no bola gbeyute ni yo Otujo fe.
We ran into Reverend Dr. Kwekwadu, MP for Ablekuma West, who came because the skies have turned unpredictable. One moment clear, the next is sudden downpour, and with each shift in the clouds, the worry in the municipality grows deeper. Flooding is no longer a question of it. It is when. So he walked the streets, listening, looking at drains, hearing the same fear in every voice. What happens when the next rain comes?
When it rained on Friday, the refuse dump here, as we can see how close we are to it, had shrunk the passageway. So talking about the solution is one, there has to be a breakthrough of this refuse dump so the water can have more access. Two, we need to go to the end point of it, which is Glefe, where the receptacle was supposed to be, and also work on the dump site over there. So at least there will be more extra holding places for the water.
We caught up with Mr. William Okanse, the NADMO director for Ablekuma West. For him, the math is simple. Stop the dumping, stop the flooding. The waterways are choking on refuse, sachets, bottles, piles of waste thrown in by tricycle load. When the rains come, there is nowhere for the water to go but up and into people's homes. He has seen the aftermath too many times. His message was blunt, that if we want dry floors, the drains have to breathe. And that starts with keeping trash out of them.
I've had a very vast land for this water, the water that comes back here, to flow and then settle. Whilst we deal with the drainage here, as the MP said. So that will be our solution. But still, we are still sensitizing our people whilst we find lasting solution to this refuse problem.
Officials are drawing a line in Ablekuma West. No more promises without action. They are pledging to bring back order by enforcing the laws already on the books, clearing what should have never been built, and giving flood-prone communities a fighting chance. For the families who watch the skies with dread, the message is clear. Safety is no longer negotiable.
Now, on the foreign front, a Russian missile and drone attack has killed at least 13 people across Ukraine, 9 in Dnipro and 4 in the capital, Kiev, marking one of Moscow's largest assaults in recent months. Dozens were also injured, including several children, after the overnight airstrikes hit apartment blocks where the emergency crews racing to find people feared trapped beneath the rubble in Kiev. Russia's defense ministry said the strikes had been a response to previous Ukrainian attacks, saying in a statement that the strike objectives had all been achieved. Moscow last week warned it would launch systemic strikes after causing or accusing Kiev of a deadly attack on a student dormitory in an occupied part of eastern Ukraine. Large plumes of smoke could be seen rising from the center of the capital, where the head of its military administration warned ballistic missiles had been fired, and the city's mayor, Vitaly, urged residents to stay in shelters. The buzz of drones could be heard between more than a dozen loud explosions as strikes made impact through the early morning. The attack caused fires near a petrol station, a construction site, and several apartment blocks, as well as 2 houses. And blackouts were also being reported across the city. Now, in the world of sports, the technical handlers of the senior national male football team, the Black Stars, have confirmed their squad for the 2026 FIFA World Cup. The decision, according to head coach Carlos Queiroz, followed detailed analysis, observations, and research on players eligible to represent the nation at this summer's Mundial in Canada, Mexico, and the United States of America.
Goalkeepers include Benjamin Asare, Lawrence Atizigi, and Joseph Annan. Defenders are Baba Rahman, Gideon Mainta, Marvin Senaya, Ali Duseidu, Abdul Mumain, Jerome Opoku, Jonas Ajete, Kojo Opompepra, and Derek Lakasen. Midfielders are Elisha Owusu, Thomas Partey, Kwesi Sibo, Augustine Boachi, Caleb Yirinchi, Abdul Fattah Isaaku, and Kamaldeen Sulemana. The forwards include Christopher Bonsuba, Ernest Nyama, Antoine Semenyo, Brandon Thomas Asante, Prince Kobna Edu, Inaki Williams, and Jordan Ayew. The team is expected to play against Wales in Cardiff later today before flying out to Washington to continue preparations for the World Cup that will kick off on June 11, 2026. The Black Stars will open their campaign against Panama on June 17 before facing England and Croatia in their Group L matches.
Black Stars head coach Carlos Queiroz says he has full trust in the 26 players named for the World Cup. He said it was a long, intensive process arriving at the decision. Coach Carlos says his players are ready to die for the shirt ahead of today's friendly against Wales and the 2026 FIFA World Cup in Mexico, Canada, and the United States of America.
Of Ghana national team, just to say that it's an honor for us to be here in Wales and play against the national team of Wales. We thank you for that cooperation. For us, it is important because, as you know, it is part of our World Cup preparation. So we want to thank to the Wales Federation, the players and coaching staff for this support. So the preparation under the specific circumstances of a modern game, which tell us that we never know when the players are available or not to start the camp. We did our best, and especially with the players that come and commit themselves to start the preparation more early. Everything was perfect. Everything was according our goals. So now we're ready. We're ready to take off and start to fly straight to the World Cup. We have to play and try to be the best team on the pitch. Try to be the best team playing football. And I know from my experience that when we play great football, we have a great chance to win the games. So this is what we want to try to do. The players, the boys are ready, are excited. So we're looking forward to play this game. We want to express ourselves in the game tomorrow as the best of our skills, efforts, commitment. As I said, the message it is simple. We want to play great football. We want to play to win. We want to bring pride and happiness to the fans. That's the only thing that I'm sure our players they have in mind. And the message, it is a message of hope and confidence that being with them, not for so many months, but the training sessions that I did with them, all of them, they are fully committed to deliver to the nation, to the flag. So I'm very much confident that the message will be positive tomorrow.
Still talking sports, and Black Stars captain Jordan Ayew says they are ready to surprise people at the World Cup, backing the commitment of the squad and the impact of new manager Carlos ahead of the international friendly against Wales later today. He believes the team is taking shape ahead of the 2026 FIFA World Cup and the players are raring to go.
Been really, really good. The boys are committed. The manager has come in and done a really, really good job to get us settled and get his ideas for us, and we've received it very well and are implementing it. So yeah, we don't have time to wait. There's a game tomorrow, so yeah, we're ready for tomorrow and we'll see how it goes. We're a new team. We have a lot of new players, and we just want to improve. We just want to go there and put on a show and represent Africa and Ghana the best as we can. And I'm confident that with the manager's ideas and with the boys' commitment, I'm sure that we'll surprise people. Yeah, we know we've lost four games, but we need to look at the performances. Some we didn't perform well, some we did well, and I always remember the Germany game as an encouraging performance. Austria, well, for me, it was not a 5-1 game, but sometimes it's the game. So listen, the FA have made a decision and they've gone into another route, and they've brought in a wonderful manager with a lot of experience and is helping us, and we're seeing the difference for the past couple of days now, couple of weeks. So listen, the past is the past. It's a new chapter, and we just need to focus on what's ahead of us, and obviously tomorrow is the first step. And I know Ghanaians, I know the country the way we are, because I'm Ghanaian, and we take things a bit too personal, but I think we just need to all be patient and be relaxed and be positive about the squad, about the team, and about the manager as well. So we as players, we're just focused on what is ahead of us, and tomorrow is the first step. But listen, we'll see what happens tomorrow. We're going in to perform well, to get a result, and to start building from there. And definitely we'll be ready for Panama.
A one-day Taekwondo Stakeholders Forum has taken place in the Volta Regional Capital. Leadership reaffirmed their commitment to strengthening the sports presence in educational institutions by equipping existing Taekwondo clubs in second cycle schools and supporting the formation of new ones.
The forum, which focused on creating awareness of Taekwondo in schools across the Volta region, brought together stakeholders to discuss strategies for establishing clubs in second cycle institutions and addressing challenges associated with introducing the sport in schools. The program was organized by the Volta Taekwondo Association in collaboration with the National Sports Authority and the Ghana Education Service. The Public Relations Officer of the Ghana Taekwondo Federation, Davis Ni Atukwe-Klote, said the Federation's objective is to build strong grassroots structures for the sports to identify and nurture young talent.
We've realized the need to introduce Taekwondo to the schools in Volta region. And to do that, we have to invite stakeholders together and then let them be aware of the importance, the significance of this sport.
The administrator of the Volta Taekwondo Association, Prosper Badohu, touched on some of the health benefits of regular participation in Taekwondo. The president of the Ghana Taekwondo Federation, Mr. Frederick Lato, too, disclosed that plans are far advanced to introduce national Taekwondo competitions for schools as part of efforts to groom young athletes for future international tournaments.
We are currently rolling out plans to expand Taekwondo in private schools across the country. We want schools not only to participate in Taekwondo, but also to own and develop the sport from the grassroots level. Our dream is to see inter-schools Taekwondo competitions organized across all regions, leading to national school championships and eventually international representation.
Some members of the whole Taekwondo club, including Comfort Difiato and John Ahajivia, expressed their ambition to represent Ghana at international Taekwondo competitions in future.
When I started from class 4, I realized that none of my friends respected me. They were all bullying me, anyhow insulting me, and I could not defend myself. I'd rather go and hide in the washroom. Then when I realized that there was a club named Taekwondo, then I decided to join. When I joined and I told my friends, they realized that they could not beat me because of the things I've been doing. From that day on, they started me respecting me.
My interest in Taekwondo increased. So at this time, I want to increase it to the international level. I want to fight for Ghana.
The Ghana Taekwondo Federation says they are hoping to establish more Taekwondo clubs in schools and communities across the country.
Nations FC etched their name into Ghana football history on Sunday, beating Dreams FC 5-4 on penalties to win the 2025-2026 MTN FA Cup at the University of Ghana Stadium after a 1-1 draw through 120 minutes.
Spectators at the University of Ghana Stadium were treated to a memorable entry of the MTN FA Cup trophy. Members of the Ghana Bodybuilding and Fitness Association delivered a scene that drew admiration from fans and dignitaries alike. The glittering trophy arrived atop a majestic white horse. Holding the coveted silverware high up was Black Muscle star Derek Marley, whose commanding presence added excitement to the ceremonial procession. This was further enhanced by 5 other bodybuilders who escorted the horse and rider into the stadium, draped in Ghana national colors of red, gold, and green, and athletes proudly showcasing both physical excellence and national pride. Their synchronized match and impressive physiques captivated the crowd, many of whom rose to their feet to capture the moment on their mobile phones. With a ticket at stake to represent Ghana at the CAF Confederations Cup competition, the game got off to an exciting note. Nations FC in the white jersey created more goal-scoring opportunities but missed them. Joseph Efa, however, put Nations FC ahead on the 31st minute with a header which beat off the offside trap. On the stroke of half-time, Abdul Razak Salifu leveled for Dreams FC with another header. Despite chances for both sides in the second half and extra time, the final remained deadlock and was decided from the spot. Nations FC held their nerve to convert all 5 penalties and left the trophy. The triumph was historic. Nations FC became the first club in 34 years to win the FA Cup after suffering relegation from the Ghana Premier League, matching Voradep's feat in 1992 when they beat the Upland Stars 3-2 on penalties after a 2-2 draw. The victory crowns a remarkable run